Hello and welcome to OT Over Easy. My name is Becca and today we are continuing on our quest to study work rehabilitation. Last week I made a video on functional capacity evaluations, so if you haven't checked that one out already, be sure to do that. Today's video I'm going to be breaking down vocational evaluations, worksite evaluations, work conditioning, and work hardening. As in the last work rehab video I made, I'm not going to be going super in-depth into these topics. Just to the level I think a student should understand. So if you want to read more in depth in these topics than I'm going into in these videos, just like last time, I'll have a list of the textbooks I'm synthesizing information from in the description below. Now let's crack on. First, let's start with vocational evaluations, sometimes also called work evaluations. A vocational evaluation is a process of exploring a person's physical, intellectual, emotional abilities, as well as their interests and their vocational skills in order to explore potential work opportunities. They're pretty lengthy assessments and can last from 3 to 10 days. Vocational evaluations can either be general or specific. A general vocational evaluation explores a person's ability to do any kind of job. A specific vocational evaluation explores a person's ability to perform a very specific job, such as a baker. When compared to functional capacity evaluations like we discussed in the last video, vocational rehabilitations have a bit more of a psychosocial focus, taking into account a person's interests to try and figure out what sort of job might be suitable for them, as opposed to strictly trying to figure out if someone has the physical capacity to perform a certain job. And that's really all you need to know about vocational evaluations. If you come across an exam question that's talking about career exploration and taking into account a client's interests, they're probably trying to get at vocational evaluations. Next up, worksite evaluations. So far, the evaluations that we've discussed, functional capacity evaluations and vocational evaluations, can be completed at least partially on the work site, but can also be completed in a clinic. A worksite evaluation, as the name would imply, is completed at the location of the job. The goal is to determine if someone can return to work after an injury or if they could benefit from some reasonable accommodations. So as a clinician, you're going to the workplace and you're making an assessment of the job demands, the environment, the person's ability to complete the job demands in that environment. In other words, you're looking at the work, the worker, and the workplace all at the same time and how they interact with each other. Again, depending on what the clinician observes, they may assess that a person would benefit from reasonable accommodations. Reasonable accommodations are modifications that the employer allows or provides in order to comply with the ADA, the Americans with Disabilities Act, to help someone with a disability maintain employment. Bit of a side note here, but it's important to understand that the ADA does not protect individuals with temporary conditions like a broken leg or with conditions that are not substantially limiting, like if they have a visual impairment that is easily corrected by commonly available glasses. So no, you can't make your employer install a ramp for you just because you twisted your ankle. But for someone who does have a disability protected by the ADA, a reasonable accommodation could include a modification to the job application process, the workplace itself, the way a job task is usually performed. It can also be something that allows the individual to enjoy the same benefits and privileges as their non-disabled coworkers, such as making sure that the employer hosts the annual Christmas party in an accessible location. You should also know that even for people protected by the ADA, an employer is allowed to deny a request for a reasonable accommodation if it is going to cause an undue hardship on the employer. For example, maybe an individual who's hypersensitive to audio stimulation would benefit from being in an environment with sound-dampened walls. If they work in an office for a mega corporation like Google, maybe that's something that Google can afford. But if they work for a small mom-and-pop business, maybe that's not something that business can afford. So under the ADA, that small business would be able to deny that particular accommodation. However, they might be able to provide something else to meet that need, like noise-canceling headphones for that individual. What is and is not an undue hardship is determined on a case-by-case basis. But these are the kinds of potential accommodations that could be identified during a worksite evaluation. Now that's enough about evaluations. Let's talk about programming, specifically work conditioning and work hardening. They are related concepts, but they are not the same. Work conditioning comes before work hardening. Just remember that C comes before H in the alphabet, conditioning before hardening. Work conditioning is programming that is designed to restore the performance skills of an injured or previously ill worker. It's very physically oriented. It can use work simulation or targeted exercises to improve musculoskeletal or cardiovascular performance. Work hardening is similar but different. First of all, it's a multidisciplinary approach, whereas work conditioning can be performed within just one discipline, which may be occupational therapy. It could be someone else. Work hardening works even more on work simulation and task replication than work conditioning does. Both conditioning and hardening seek to physically prepare the individual for work, but work hardening is a more holistic approach that also prepares the worker mentally, which is facilitated by having multiple disciplines involved. Furthermore, work hardening programs can progress to transitional employment programs, whereby the individual begins to perform tasks actually within the workplace. Work hardening programs typically run for a few hours of the day. You might start with only 2 or 3 hours and then work your way up to maybe a full day. You'll go 3 to 5 days a week for 1 to 3 months. It just depends on the needs of the worker. Think of work conditioning and work hardening as the same treatment as it progresses over time. You start with work conditioning, where a client will work with just one profession to build up their strength, their endurance, and other base skills they're gonna need for work. Then when they're ready, other professionals enter the picture to help that person really maximize their ability to return to work, and that's work hardening. And that's it for these concepts. Again, pretty brief, but should cover most of what you need to know for an exam. I hope this video made learning them a little more easy. I'll have one more work rehab video coming out soon about ergonomics and injury prevention, so keep an eye out for that, and happy studying! Reasonable accommodations